That's a really great question, and one that we get asked a lot. Actually, one of probably the biggest motivating factors for 14, 15-year-olds to take better care of their diabetes is because they often are made to understand by their parents that if they can't be responsible about taking care of their diabetes, they probably can't be trusted with car keys. So it's actually a pretty good motivation for the young man or young lady to really pay attention to really monitoring and taking care of their diabetes. My good Presbyterian mother used to always quote a Bible verse about he who is faithful in little is also faithful in much. With specific reference to diabetes, however, we actually, again, and every diabetes team would have a fact sheet about driving with diabetes. The big concern is about getting a low blood sugar while driving, in which case you might pass out, in which case you might have an auto accident, in which case you might hurt not only yourself but other people. And furthermore, when the police come and they see that you're passed out, they're going to assume either that you've had a major brain concussion because you've hit your head, or that you've been drinking excessively, and therefore it may be 3 or 4 hours before they figure out that you in fact have diabetes. And so we have some rules, and the rules are pretty straightforward. One is you have to wear a MediAlert tag. That is a tag that says, I've got diabetes, so in case you are in an accident, somebody can figure out real quickly that you've got diabetes. Second issue is that you always have to have some form of sugar in the car, and if in fact you're feeling low, you need to get off to the side of the road as quickly as possible and as safely as possible. Get the sugar in you and don't restart the car and start moving again until your blood sugar is back into a good range. Thirdly, you should always have a glucose monitor available with you in your purse and the car pocket. And there are 2 rules on that. Number one, it should always be available. And unless you have just eaten a meal, then when you get in the car, as part of your start in the car routine, you check your blood sugar. And if your blood sugar is less than 80, you don't move the car until you've done something about your blood sugar. And that's just the rule. If you want to drive, that's what you do. Parents are really good about enforcing those rules because they understand that auto accidents are expensive, but furthermore that auto accidents can be very dangerous to their child. And so the rules are pretty straightforward. You monitor your sugar whenever you get in the car, unless you've just eaten a meal and know your sugar's not low. Secondly, you always have an appropriate way to monitor your sugar. 3, that you always have to have some form of sugar available in the car. And it's not an ifs, ands, or buts. It's not negotiable. And you got to wear a MediAlert tag. It's not an ifs, ands, or buts. It's not a negotiable issue. If you want the car keys, this is what you have to agree to do. And you know, most teenagers kind of understand that. They kind of get it, because you know what? Most parents don't have a real problem in saying to the kid, you know, if can't be trusted to take out the trash, then you really can't be trusted to drive a car.